Hello students, myself Jyoti Aurwade, Assistant Professor from D.Y. Patil College of Nursing. Today we will discuss a topic from the midwifery, that is a diagnosis of a pregnancy. As you know, the meaning of a diagnosis is to diagnose the problems, or we can say changes, which takes place in a normal human body. So the same thing we are going to discuss here, the diagnosis, the changes which will be there in the pregnancy. So at the end of the lecture, you the students will be able to explain the diagnosis. There are the diagnosis in the 3 trimester, the first, second and the third trimester. There are different signs and symptoms of that each trimester, and the different investigations which will be carried in each trimester. So students will able to tell after the end of this class. First we will introduce the topic, that is diagnosis of a pregnancy. As I told you, the diagnosis changes will be there in each trimester. The same thing we will discuss here, the changes in the each trimester. So first of all, the gestational age. You can say it also a period of a gestation. Period of gestation. Gestation, it is nothing but a pregnancy. Then period of what? Pregnancy. That is the period of a pregnancy, or the gestational age. So this gestational age calculated from the first day of last menstrual period. So when it is also called as the LMP, the first day of last menstrual period. So that is nothing but a gestational age. Next, duration of a pregnancy. The total duration of a pregnancy, it's a 9 calendar months and the 7 days. If we will count it in a week, that is a 40 weeks. If we will count it in a days, that will be a 266 approx date. Next, there are the 3 trimester, first trimester, second trimester and the third trimester. First trimester is the duration of 1 to 12 weeks, that is the first 3 months. Second trimester is the duration of a 13 to 28 weeks, that is a 4 to 6 months. Third trimester is a duration of 29 to 40 weeks, that is a 7 to 9 months duration. So these are the 3 trimester, each comprised of 3 months, and togetherly this will be a 9 months. Okay, the next one, the diagnosis. There are different diagnoses and the different trimester. So each trimester changes we will discuss under the heading of a diagnosis. So first we will discuss about the diagnosis in the first trimester. So again, those are divided into the symptoms and the sign. So subjective symptoms, what the mother will experience, that is the first thing, most important, that is amenorrhea. Amenorrhea, it is nothing but a cessation of a regular menstruation, and that is because of the increased level of estrogen and the progesterone, and that is produced by whom? That is produced by a corpus luteum. So what is this corpus luteum? When the ovum will get released, and the remaining body, that is called as a corpus luteum, that is also called as a yellow body. So that is the first thing, or the first diagnosis of a first trimester, that is a amenorrhea. The next diagnosis, it's a morning sickness. So morning sickness, it happens in all the 50% cases of a pregnancy, and mostly it is seen in the primigravida women. So what is there in this heading? So there will be a nausea, vomiting, and that usually happens after the cessation of a menstruation, and it continues up to the 16 weeks. So when this will be mostly appears, the nausea and vomiting will be there mostly in the morning session and after rising from the bed. But this doesn't affect the health status of the mother, and it is mostly commonly present in the primigravida woman. So why this nausea and vomiting is present? As we know, the hormone HCG, human chorionic gonadotropin hormone, so it will get released from the placenta, and what it does, it relaxes the sphincters of this system. like a cardiac sphincter it is there, so it relaxes the system and there will be a regurgitation. So regurgitation, it is nothing but a backflow of the gastric content. So this, because of this hormonal changes, mainly in the SCG change, there the nausea and vomiting will appear in the pregnant woman. So that is the second diagnosis. First it is amenorrhea, second it is a morning sickness, third that is a implantation bleeding. The implantation bleeding, it is also called as a placental sign. So what happens in this, there is a slight bloody discharge at the time of a first missed period in between 28 to 35 days, but it does not take, this bleeding should not get confused with the menstruation. This bleeding is there because of the implantation of the placenta. So don't get confused with this bleeding as the last menstrual period. This is the bleeding of a bleeding because of the placenta. The LMP is considered the first only. The bleeding it is there, that is not a menstruation, that is a implantation bleeding. So that is a third diagnosis. Fourth one, that is a frequency of micturition. So as you can see in a diagram, the uterus is in between the bladder, the front it is a bladder, and back you can say, or you can see there a rectum it is there. So what happens, as there is an enlargement of the uterus, the enlarged uterus is start creating a pressure on the urinary bladder. So what happens, there will be, if there is a pressure on the urinary bladder, the mother feels frequently to go for the urination, and that is nothing but a frequency of a urination, and that is increased more in between 8 to 12 weeks, because that at that time the uterus is bending, or it will be on the this bladder. Causes are resting of the uterus on the bladder fundus, congestion of the bladder mucosa due to the increased vascularity, there is a change in the osmoregulation, there is a changes in the osmoregulation. So what will happen with this osmoregulation, there is an increased thirst and there is a polyuria, but this is usually disappears after the third month. So this is the fourth diagnosis of a pregnancy, that is frequency of micturition. The next one, breast discomfort. So what happens in the breast discomfort, there is a enlargement of the breast, heaviness, discomfort, and the pricking sensation will start to appear after 6 to 8 weeks of a pregnancy. Next, appetite changes. So appetite changes, it is nothing but, as you can see, the way many women will start to eat the unusual substances, the substances which are not made for the food, or we can not ingest it, but some of the women feel like eating that is a craving for a certain type of a food and refusal of other food. It is also called as a pica. So mother feels to eat unusual substances. The next one, that is a fatigue. Fatigue is present in the early pregnancy. What happens in this, the mother is easily get fatigue and the tiredness. The mother feels to be asleep, to go for the sleep, and there will be a lack of concentration. So these all are the symptoms. First one we have seen amenorrhea. Next one, morning sickness. Third one, that is implantation bleeding. Fourth, frequency of micturition. Fifth, breast discomfort. Sixth, appetite changes, and seventh, it is a fatigue. So these are the 7 symptoms which is present in the first trimester. Next are the objective sign. What are the signs we can see? So first one, breast changes we can see. It appears after 6 to 8 weeks. What happens in this breast changes now? There will be increased size and vascularity in the breast, and the veins which are there, that will be visible under the skin. Why? Again, there is a increased vascularity, blood flow is increased, so we can able to see the veins. Increase the pigmentation of the nipple and the primary areola. Next one, the Montgomery tubercles will start to appear more prominently, and there will be a expression of a colostrum. Colostrum, it is nothing but thick yellow secretion. It is present as early as 12 weeks of a pregnancy. So you can see in the images, there are its enlargement of the breast and there will be a Montgomery tubercles. Along with the primary areolae, there will be a development of a secondary areolae near to that primary areolae. Okay, these are the changes which we have seen in the breast. Again, there will be a changes in the abdomen. And what will be that changes? The uterine remains pelvic organ until the 12 week. What will be happen after the 12 week? It will go above the pelvic organ. So uterus remains pelvic organ until the 12 week, because we are discussing about the first trimester. So we have mentioned it till the first trimester only. And in the first trimester, uterus is in pelvic only. So may felt per abdomen at suprapubic bulge. Next will be the pelvic changes. So what will be the pelvic changes? So under that there is a first one, that is a vaginal signs. So this signs, there are some signs like a Jacquemer signs, Ozander signs. So this will be asked you for the multiple choice question. So MCQ they will ask you like a bluish coloration of the vagina. So explain, or dot will be the bluish coloration of the vagina. So that is nothing but a Chadwick song. So you have to guess it correctly. This names may confuse you, but you have to be thorough with this signs. First one, Jacquemer sign. It is also called as the Chadwick sign. So what happens in that? There is a local vascular congestion in the vagina and bluish to purple discoloration appearance of the mucous membrane of a vagina. So that is nothing but a Jacquemer sign. Bluish coloration of the vagina, that is Jacquemer sign, also called as a Chadwick signs. Next one, it is a Ozander sign. What is there in a Ozander sign? Increased pulsation felt through the lateral fornices of the lateral furnaces. So that is called as the Ozander sign. Next one, cervical changes, that is in that Goodell sign will be there. The Goodell sign, it is nothing but cervix become soft. It feels like a lip of the mouth. The non-pregnant cervix, it feels like a tip of a nose, but this is a pregnant cervix, so it feels like a lips of the mouth. So Goodell sign, it is nothing but a softening. Jacquemer sign, that is nothing but a bluish coloration. Ozander sign, that is nothing but a pulsation felt through the lateral fornices. The next one, there will be a uterine sign. The size is increased. So the size at the 6th week, the uterine size at the 6th week is at equal to the hen's egg. At 8th week, it will be equal to the cricket ball size. At 12th week, it will be equal to the fetal head size, and it will be become a globular. And as the weeks will increase, their enlargement of the uterus will be takes place. The one half of the uterus is more firm than the other half, and that is called as the Piscax sign. Next one, Hagar sign. So as you can see the image, one hand is kept inside the vagina, other hand will be kept above the uterus and above the abdomen, and we need to grab the uterus in between these two hands. So what happens in this? The findings, upper part of the body of the uterus is enlarged, and the lower part of the body is empty and extremely soft. The cervix is comparatively firm, so you can able to grab in between these two hands. That is nothing but a Hagar's sign. The next one, it is a Palmar sign. It is done at the 4 to 8 weeks. Then what happens in this Palmar sign? We have to rub our hands. We need to place it on the mother's abdomen. If the hardening of the uterus is present, hardening it is mean by the contractions. So hardening is present, that is nothing but a presence of a contractions. So that is the Palmar signs. So these are the some signs which we have discussed. First, Jacquemer sign, bluish discoloration. Ozander sign, pulsation felt. Goodell sign, that is nothing but a softening of the cervix. Hagar sign, you can see, able to see the images, the in between the two by these fingers the uterus has been grabbed. Palma sign, we can able to feel the contractions. Next one, immunological test for the diagnosis. So what chemical changes will be there, by that you can say that mother is pregnant. So the most important, it is the level of a hormone HCG, human chorionic gonadotropin, presence of a HCG maternal plasma and its secretion in urine on the basis of an endocrine test of a pregnancy. HCG, it will start to release after 8 to 11 days after the conception. Tests depend on the detection of antigen HCG, which is present in the maternal urine and the serum. The next one, the first one, that is a HCG, testing of the HCG. If the hormone HCG level is increased, that suggests that positive pregnancy test. The next one, it is a ultrasonography. So transvaginally ultrasonography has been done, or the transabdominally also, through the abdomen also this is done. So what will be there according to the weeks has been given here. In the 5th week there will be a just formation of a gestational sac and the yolk sac. At 6th week there will be a appearance of a fetal pole, cardiac activity will be there. 7th week embryonic movement will be there. 7 to 12 week fetal gestational age, and it is also measured by a CRL. CRL, it is nothing but a crown rump length. The baby's crown to the baby's toe, the length, baby's sacrum till the buttocks, the length is measured. The gestational sac is visualized by after 4.5 menstrual weeks on transvaginal ultrasonography. So that is all regarding the first trimester. We have seen the symptoms, different symptoms which mother experience. Sign, the breast changes will be there, pelvic changes will be there, vaginal changes will be there, the uterus changes will be there. Then after that we have discussed the immunological changes. In that we have discussed the HCG changes will be there. Through the ultrasonography also we can come to know the mother is pregnant or the not. The next one, what happened, what will be changes there in the second trimester. So in the second trimester the symptoms are amenorrhea, obviously it will get continuous, then nausea, vomiting, and frequency of maturation will gradually decreasing. So why this gradual decreasing? Because the uterus will accommodate space in the abdomen, so it will start decreasing a pressure on the bladder. Okay, the next one, progressive enlargement of a lower abdomen. Now it is the second trimester, the uterus come out of the pelvis. The quickening, it is a fetal activity, okay, that is felt by the mother. Feeling of a life or active fetal movement, that is felt by the woman. Then in a primigravida mothers, it will start to appear from the 18 weeks. In the multigravida woman, it will start to appear after the 16 weeks. Its appearance is an unuseful guide to the calculate the expected date of a delivery. The next changes which takes place in the cutaneous changes, skin changes will be there. As you can see in the images, there is a linea nigra and the stretch marks, that is called as a stria gravidarum, that may be pink color, and the stria albicans that appears after the delivery, that is called as this, that will be a whitish in color. So the first one, that is a cloasma. Cloasma, it is nothing but a butterfly like structure will start to appear on the face of a mother. Okay, on the cheek, forehead also that will start to appear, that is called as the cloasma. Pigmentation over the forehead and cheek after the 24 weeks. So linea nigra, it is a hair like structure, runs from the this one runs till the umbilicus or above the umbilicus, that is a linea nigra, and stretch marks are nothing but a stria gravidarum. There will be a breast changes, more enlargement of the prominent vein under the skin. skin, secondary areola appears at about 20th week. Montgomery tubercles are more prominent. There will be a development of a secondary areola just near to the primary alveoli. The colostrum that will become more thick, more yellowish, and there is a more prominent stria gravidarum. We can able to easily see the stria gravidarum. Abdominal examination, on the inspection, as we have seen, the linea nigra, it is present, the stria gravidarum are present, and on the palpation we can able to measure the fundal height. Now what is mean by fundal height? Fundal height, it is nothing but this is the measurement from the symphysis pubis to the upper border of the uterus. So the suppose this is a symphysis, from the symphysis pubis to the upper border, the area or the distance of that is called as the fundal height. We are taking it till the fundus of the uterus, so it is called as the fundal height. And the fundal height will increase as the weeks will increase. Next one, Braxton Hicks contractions. So these contractions are present from the early weeks of the pregnancy, felt during bimanual palpation in early weeks or during the abdominal palpation. So but these are the irregular, infrequent, spasmodic and painless and without any effect on the dilatation of the cervix, and mother is not conscious about the contractions. As we can see, we can able to feel this by placing our hand on the abdomen. Next, at 20 week, the palpation of the fetal parts will start. Okay, 20th week, the external ballotment is elicited when the fetus is relatively smaller than the volume of an amniotic fluid. Now the thing is that what is ballotment? So in a ballotment there are two types, internal ballotment or the external ballotment. So as you can see in the image, we have to place one hand to the one side and throw the baby to the other side, so it can go to that side and it come back to its previous place. If it takes place, that suggests that ballotment is present. If that is done per abdomen, so that is called as the external ballotment. In another image you can see it, we have to done it by the fingers. We have to push the baby to the fundus, so baby will again come back to the normal place. So if this is present, then that suggests that internal ballotment is present. The next one, auscultation. Here we can able to hear the fetal heart rate, that is here in between, that is the fetal heart rate audible in between 18 to 20 weeks, and that will be detected by the normal ordinary stethoscope also. The normal fetal heart rate is 110 to 160 beat per minute. Next one, it is a vaginal examination. The bluish, as we have seen, there will be a increased vascularity. The bluish discoloration of the vagina, vulva and the cervix will be seen, and the internal ballotment can be elicited. So as you can see, the internal ballotment. The next one, what investigations you will do here? Again the same, the routine sonography will be done. So but here you can able to find out the different things of a baby, like a biparietal diameter we can able to elicit, then the head circumference, abdominal circumference, femur length, that will be there in the second trimester. It is most accurate when done between 12 to 20 weeks of pregnancy. The fetal organ anatomy is also been detected to know whether there is any congenital anomalies will be there or no other any anatomical anomalies will be there. That will be again finding out is done with the help of ultrasonography. Fetal viability is determined by the real-time ultrasonography. Absence of a fetal cardiac motion will be there, then that suggests that there will be a death of a fetus. If there is necessity to do the MRI, that will be done to find out the any skeletal abnormalities or any other anatomical abnormalities. The next one, last trimester changes will be there in between 19 to 40 weeks, last trimester, last 3 months of a pregnancy. Same the symptoms, amenorrhea will be continuous, enlargement of the abdomen, uterus enlargement progressively to term when it fills almost the entire abdomen, means the whole abdomen now it is filled by the baby. This produces some maternal discomfort such as the dyspnea and the palpitation. So what happens, because of all this filling of a baby, it will start to creating the pressure or the structure which is near to that. So you can able to see here, now the fetus it is there, the structure which is near to that, above the lungs it is there, mostly it is start creating a pressure. So what will happen, the mother will suffer from the dyspnea, difficulty in the breathing, and the palpitation. Palpitation is a rapid breathing, okay, like this, okay, mother will feel that. Next one, frequency of a mixture, it again now reappears as there is a enlargement of the baby. It will again start to create a pressure on the uterus, this bladder, and the frequency of a micturition it reappears as the head descent into the pelvis, comprising upon the bladder and the urethra. Next, food. Now what will happen about the fetal movement? Now the fetus is fully developed, the baby can able to move his hands, legs very goodly, so the baby is taking more movement as compared to the previous one. The fetal movements are more frequent and more pronounced. The lightening will be there after 36 weeks, especially in the primigravida. Now what does it mean by the lightening, that I will show you. Now you can see that where the baby buttocks, now it is near to the lungs, but what happens, the baby's head it comes down, and so the baby's decreasing the pressure on the lungs. So because of the lightening, the pressure has been decreasing, and the problems like a dyspnea and palpitation that has resolved at the some extent. Next are the signs. The painless uterine contractions will be there. Then the fetal movements easily felt, seen, and the felt easily. Even in some cases we can able to see this one fetal movements. So ballotment is generally not elicited because the now this uterus is completely filled by the baby. The fetal heart rate is heard more clearly if the fetus is alive. The uterus enlarges progressively till the term. Then the symphyso-fundal height, that is nothing but a fundal height, is increasing as the weeks will increasing. And how to do this? The woman will be placed in the dorsal position. The woman has been asked to empty the bladder, and then only at a correct time we need to measure the fundal height. Sonography, gestational age estimation. Through the sonography we can estimate the biparietal diameter, head circumference, abdominal circumference, femur length, that will be elicited. Then next, placental anatomy will be there. Then where the placenta is located, whether in a upper segment or in a lower segment, that has been seen. Then the lie of the baby, presentation, then presenting part, that all things will be elicited by the sonography. Cutaneous changes, same. There is an increased pigmentation of a stria gravidarum, that is more definite. Uterine shape, that the cylindrical shape to the spherical shape at the 36th week. Signs of a pregnancy. So till this we have discussed the 3 trimester. In each symptoms in we have discussed the different symptoms in each trimester, different signs in each trimester. So these are the signs of a pregnancy which is classified under the heading of 3 things, that is a presumptive sign, probable sign, and the positive sign. Presumptive sign means what? The presumptive signs are the signs which only be experienced by a woman. सो ये कौन बता सकता है कि व्हाट इज हैपनिंग टू मी और द व्हाट इज द मदर इज सफरिंग फ्रॉम व्हाट, ये कौन बता सकता है? दैट पर्सन ओनली. सो द वुमन ओनली टेल्स व्हाट ऑल थिंग्स विल बी हैपनिंग विथ हर ड्यूरिंग द प्रेगनेंसी. सो ऑल दैट सिम्टम्स, उसको क्या बोलते हैं हम? वी आर टेलिंग दैट एट अ प्रिजम्पटिव साइन. The next one, it is a probable sign. Probable sign मतलब क्या है कि maternal physiological changes which are detected upon a examination by examiner. Means as a staff, as a nurse or as a doctor, what we are observing in the patient body, what changes will be there in the patient's body, that is called as the probable sign. And next one, positive sign, if we will tell the mother to go and do this examination or do this test, so after doing that test particular result will come, and on that result the finding will suggest that okay, this is a positive pregnancy. So that all things are called as the positive sign. So the diagnosis of pregnancy is described under this heading also: presumptive sign, probable sign and the positive sign. These are the presumptive matlab the woman experience, probable as an examiner what we can find out, positive matlab what investigations will tell us. Presumptive sign matlab kya? Which mother experience. First is the amenorrhea, cessation of menstruation. Obviously the mother itself who is suffering nausea, vomiting, ये कौन suffer हो रहा है इससे? The mother, frequency of a micturition, mother, fatigue, enlargement of a breast, Montgomery tubercle appearance, expression of a colostrum, pigmentation of the skin, that is called as a cloasma, stria and the quickening. This togetherly is called as the presumptive sign. Next, it is a probable sign. As I told you, ये कौन who will understand this? The examiner. The change, there will be a change in the shape of the uterus, as we have seen the images how to do this Hagar sign. That Hagar, demonstration of Hagar sign, we can do that. Chandwick sign, we can observe that. Goodell sign, softening of the cervix, ballotment of the uterus, then the Braxton Hicks contractions will be there. Those are called as the probable sign. The next and the last one, that is a positive sign that directly tell about the presence of the fetus. Yes, what because of what we can say that now mother is pregnant? Okay, there is a one test that is called as the UPT, urine pregnancy test. So what happens in this test? There is an increased level of hormone HCG and that comes in a urine, so the urine pregnancy test is positive. But we cannot say that every urine positive test mother, she is a pregnant woman. That is not a confirmatory test. So what is the confirmatory test? Only the ultrasonographic examination, it is called as the confirmatory test. Confirmation of the pregnancy is not done by the urine pregnancy test. It is, again I am telling you, it is done only by the sonography. In a positive sign, visualization of the fetus by the ultrasound, visualization of the fetal skeletal by the X-ray. FSH is done, okay, sorry, FSH is heard by the fetoscope or the stethoscope. Then fetal movement, that will be palpable by the examiner. Visualization, as I told you, we can able to see also fetal movement, palpation of the fetal part. So this all things will be there and we can able to see, feel any of this, that depend on that we can say that this mother is pregnant. So these are the signs of a pregnancy. So after all this, I can summarize my topic. So in this class we have discussed about the diagnosis of a pregnancy, 3 different trimester, the sign and symptoms of each trimester, and here we will summarize our topic. So far we have discussed about the diagnosis of pregnancy, and this is an important topic and it should be applied whenever and wherever necessary, especially in the maternal OPD and the wards during the antenatal care and the practice. practices. So after this discussion, and I will give you an assignment to write a short note on the diagnosis of a pregnancy in the first trimester, diagnosis of a pregnancy in the second trimester, sorry, not in second, third trimester, and write down about the immunological test of a pregnancy. If you want to give a test or conduct the test, you can have a look to this one. There will be a SAQs, changes in the first trimester, second trimester, third trimester, and as the last three signs we have seen: presumptive sign, probable sign, and a positive sign. So in the last a long answer question, you have to write about that three signs: presumptive, probable, and the positive signs, for the 10 marks. So this will be the test for you people. Okay, if you want to have refer the books, you can just go through these books. For the images, you can just go scroll to the Google, and thank you.